you want to lose weight using Duromine and you're not sure if it's right for you? So watch this video where I answer your questions on weight loss regarding the use of Duromine. Hi, my name is Dr Ettang and I'm a family doctor working here in South Africa. And in this video, we're answering some of your questions that you've sent to me recently in the past few days regarding the use of Duromine in your weight loss journey. But before I go ahead, I do have a disclaimer for you. But before I get into your questions, what is Duromine? So for those who don't know what Duromine is. So Duromine is a brand of medication called Phentermine, and it's also one of the oldest appetite suppressing drugs in the market. It's actually been around since 1959. It is an amphetamine-like type of stimulant, and it has the properties to be able to be an appetite suppressant. And it comes in different doses, especially here in South Africa. We have both the 15 milligrams dose and the 30 milligrams dose. In other countries, it's registered as an anti-obesity drug, but here in South Africa, it's also registered as a Schedule 5 weight loss drug, and it functions by targeting a part of your brain that controls your appetite, or that's responsible for your hunger. So because it's a Schedule 5 medication, you will need a doctor's prescription to get access to this medication. And it comes in a capsule format. And that capsule contains a chemical called resin. And what resin does that it makes it easy to release the Duromine into your system over the course of a full day. So here are a few things you need to know about Duromine. Number one, it is cheap. Two, you can use it for a period of 3 months at a time. And thirdly, it must be used under the care of your GP or your primary care provider. So how does Duromine actually work? What does it do? So there are two ways it works. One, remember I mentioned that it's an amphetamine-like type appetite suppressant. So what it does is that it stimulates a part of your brain which we call the sympathetic nervous system. And for those who need life science or biology, you know what that means. The part that we call the fight or flight system. So this fight or flight system is usually activated during the time of stress, and it can make your body get ready for either to fight or to flight. But one of the things that it does is that it can also make your body or certain systems in your body to shut down. And in this case, it makes your gastrointestinal or your digestive system to shut down. And when this shut down, it subsequently leads to appetite suppression. However, remember I also mentioned that it is a stimulant. So the stimulant part of the effect works in a way that it makes your body feel more awake, more alert, and in some cases more energetic, despite the fact that you're not eating. And then by that, it also allows you to remain much more physically active during the course of the day, leading to more burning of fats and leading to your weight loss. Now, what are the common side effects of Duromine? One, it causes a dry taste in your mouth, or causes a dryness of your mouth. It can cause constipation, nausea, abdominal cramps. It can increase your heart rate and increase your blood pressure. It can cause headache, dizziness, tingling sensations in your hand and feet, palpitations in your heart. For those who have anxiety, they usually have a worsening form of anxiety, and also it can affect your sleep. Now, there are some people that the use of Duromine is a no-no for. And some of those people include people who have uncontrolled hypertension, uncontrolled diabetes, heart diseases, arrhythmias, atrial fibrillation, seizure disorders, strokes, anxiety disorders, depression, and pregnancy. So if you fall into this category, unfortunately, you have to look for an alternative form for your weight loss journey, because Duromine is not good for you. So now that I've mentioned the common side effects of Duromine, I'm also going to go back to some of the questions some of you have sent. So Nandy's asking, she says, does Duromine work for everyone? And the answer is no. Duromine does not work for everyone. There's some people it works for, and some people it doesn't work for. And those that it doesn't work for, they might need an extra change to their diet, or extra change to their exercise activities to supplement their weight loss journey. The next question here is coming from Lelo. Lelo says, can Duromine affect my anxiety? And the answer is yes. In fact, Duromine can make an existing anxiety disorder even to get worse. I have a question here from Kemi. Kemi says, is Duromine effective? The truth is that Duromine is most effective in short-term weight loss. So it is effective if you're using for a short-term period. But you must also be aware that when you stop using Duromine, there is a likelihood that you'll get what we call a rebound weight gain after you stopped the use of Duromine. So be aware that that exists regarding Duromine. All right, the next question is, it says, hi doc, I've been taking Duromine at 15 milligrams and I'm not losing weight. Will taking a higher dose help me lose weight more? And the answer is, taking a higher dose is not likely to help if the initial dose is not working. All right, next question is, can I stop my exercise and dieting now that I am on Duromine? Nice one. The answer is no. No. So exercise and dieting has to supplement the work of Duromine. Duromine does not replace a bad diet. It doesn't replace a sedentary life. So all those things should be done together in synergy towards your weight loss journey. Next question here is from Lutando. It says, what is the best time to take Duromine? Best time. So my recommendation to my patients, I tell them to take Duromine if they can wake up at 5 a.m. in the morning, and once it gets to 9 a.m. in the morning and they have not taken it, they should not take it because it has the potential to affect your sleeping pattern. So it's good to take it earlier in the morning and not take it much later, so that you don't have that increased energy and alertness and making it difficult for you to have a good night's sleep. All right, the last question I've received here is, I am pregnant. Can I take Duromine? And the answer is no. So in summary, Duromine may be effective in supporting short-term weight loss since it can produce effects quite quickly. But just recognize that the effects of Duromine on your appetite may be effective in the first few weeks after you started Duromine, but the effect over the appetite can get weaker over time. Now, this video is not here to promote the use of Duromine. However, if you do decide to use Duromine, then use it as a temporary support tool in your weight loss journey for a short period of time with the aim to come off the Duromine and subsequently to get your diet under control. In addition to that, please, if you intend to use this medication, please consult your doctor, your GP, your medical officer in the hospital where you're working, and let him do an assessment for you and check your blood pressure, check your heart rate, do a thyroid test for you, check your kidney function, assess that you do not have any risk that could potentially make the use of Duromine detrimental to your health. Now, do you or your friend or family member use Duromine? Let me know what your experience is in the comment section below. And if you found this video helpful to you, please help me like this video and share it to someone you feel that this video may be of value to. Thank you very much. God bless you and have a wonderful day.